In the name of God. Hello, dear friend. This is Dr. Ashabi. This is the last session of blood circulatory system. Today, we will discuss muscular activity during exercise and which factors could regulate the muscular activity, neuronal pathway and humoral pathway. We will discuss about that. And after that we will see what is coronary circulation and how the coronary circulation is controlled in our body, and finally we will see what happened during bleeding and some emotions such as excitation. The muscle activity will increase during metabolism and temperature enhancement, activation of some hypothalamus parts which related to heat control, during activity of sweating glands or sweating. By increasing bradykinin level, the muscle activity will be increased, and by skin vessels vasodilation also we can see muscle activity increase. And finally, hyperemia in the skin, it means that increasing blood flow under skin vessels could increase muscle activity. When a volunteer or a human decided to do muscular activity, some voluntary impulses from cortex will project to hypothalamus and vasomotor center, and these centers increase heart rate and heart power, induce vasoconstriction in kidney and gastrointestinal vessels to push blood into the muscles. Also vasodilate muscles, and local control helps to vasoconstriction and vasodilation, except the neuronal control. You can see in this figure, when a subject or a volunteer started to do a rhythmic exercise, the blood flow will be increased. You can see from minute 10 to minute 16, when the rhythmic exercise is done by a volunteer, the blood flow enhancement is seen. How this blood flow increase? Blood flow will be increased through muscle contraction, and increased blood flow in muscle capillaries during exercise are seen. Which factors can control this blood flow? One of them are local chemicals or humoral factors, and the other factor is nervous control of muscle blood flow. Let's talk about local chemicals. When a muscle is doing exercise, or we are doing exercise, muscles are using oxygen for increasing ATP and producing energy for contraction of muscle cells. So the oxygen level is going to drop, and this hypoxia or reducing the oxygen level is one important factor for increasing blood flow. So reduction of oxygen during metabolism, increasing metabolism is important factor, and oxygen is important chemical effector for increasing blood flow. The other factor is adenosine. Adenosine can be considered as important vasodilator, but in laboratory experiments can see that the adenosine cannot increase blood flow as much as oxygen during exercise. So during intense exercise, adenosine has less effect rather than hypoxia or reduction of oxygen. So imagine the level of oxygen is going to be low during exercise, and by increasing blood flow the level of oxygen is going to be high. So after the intense exercise, which factors helps to continuing blood flow, because by increasing blood flow there is no hypoxia and the demand for oxygen is supported. So some other factors or chemicals, local chemicals, helps for continuing blood flow or remaining blood flow during exercise or long-term exercise. One of them are potassium ion, adenosine triphosphate, lactic acid, carbon dioxide. All of these four factors helps for blood flow as long as exercise continues. So, one of the important factors for regulation of blood flow is local regulation that is done by oxygen. Hypoxia is important chemical for local increasing blood flow during exercise. The other control is doing by nervous control, by sympathetic vasoconstrictor nerves. During exercise, sympathetic system is active and sympathetic vasoconstrictor nerves fibers secrete norepinephrine at their nerve ending. And this norepinephrine is important vasoconstrictor. Also, in addition to norepinephrine, which is secreted by sympathetic nerves, the medulla of the adrenal glands secrete high amount of norepinephrine and epinephrine into the circulating blood during exercise. And this can vasoconstrict and also vasodilate vessels. You know, epinephrine doing by beta adrenergic receptors and act as a slight vasodilator in vessels, and also norepinephrine acts through alpha receptors and do a vasoconstrictor in the vessels. So by increasing blood flow and constriction of vessels, the pressure and blood flow will increase too. Also, please remain the vasodilatory effect of epinephrine that in some cases may be by activation of sympathetic system, vasodilation is seen. Circulatory readjustment during exercise. There are three major effects occur during exercise that are essential for circulatory system to supply the blood flow for muscles. Let's see what are they. There are three important ways. Where first, sympathetic nervous system activation, and so stimulate circulation and increase blood flow. Second, increase arterial pressure. Third, increase cardiac output. Let's see each of these three one by one. The first is effect of sympathetic discharge. During sympathetic activity in exercise, heart is stimulated to an increased rate and increased pumping stretch. Most of the arterioles of the peripheral circulation are contracted except those for active muscles. It means that the arterioles in the GI system, gastrointestinal system or kidney system are contracted. Muscle walls of the veins are contracted, which increase the mean systemic filling pressure. Systemic filling pressure is the pressure is only in the systemic circuit, not in the heart or pulmonary circuit. Also during absence of flow. It means that when there is no flow, when a pressure is seen in systemic vessels, it means systemic filling pressure. Second factor for circulatory readjustment during exercise is increased arterial pressure due to sympathetic stimulation. Vasoconstriction of arterioles and small arteries in tissues other than the active muscles is seen. Increased pumping activity of heart rate is seen by increasing arterial pressure. And finally, great increase in mean systemic filling pressure also is seen by increasing arterial pressure during exercise. There is a question. We know that some vasodilators such as hypoxia or adenosine or potassium can vasodilate vessels, and some vasoconstrictors such as epinephrine and norepinephrine can regulate vessels vasoconstriction and increase blood flow. So why blood pressure or increased arterial pressure during exercise is important? In laboratory, they do an experiment for answering this question. When the muscle doing exercise without increasing arterial pressure, muscle blood flow rises more than 8-fold. But we know that muscle blood flow can able to increase 20-fold more than normal activity. So this is showing the importance of arterial pressure. For example, imagine that arterial blood pressure rises 30% during heavy exercise. This 30% increase causes 30% more force to push blood through the muscle tissue vessels. So, in parallel with increasing blood flow, by increasing heart rate or contraction by sympathetic system activity, the arterial pressure push more blood to increasing the blood flow and helps for more circulation of these bloods. The third important factor is cardiac output increasing during exercise. Heart rate will increase during exercise, often up to rates as high as 170 to 190 beats per minute, increased stretch of contraction of heart, and often we can see twice increasing the stretch of heart rate. By increasing cardiac output, systemic filling pressure is going to be increased, and also venous return is going to be increased, and this increasing venous return is caused by decreasing resistance in blood vessels in active muscles. So by reduction the resistance, the blood flow is going to be larger and larger during exercise. Here you can see when a human want to do an exercise, skeletal muscle mechanoreceptors and metaboreceptors is sending for vasomotor center. Also cardiac receptors, baroreceptors, chemoreceptors, also they are sending afferents for vasomotor center. So by collecting all of these afferents, the vasomotor center can activate sympathetic nervous system and increase heart rate, vasodilate and vasoconstrict some vessels. So this is the effect of a neuronal pathway of controlling cardiovascular function when a human is going to do an exercise. So we know the importance of heart rate or cardiac output. Let's see what is the anatomy of coronary blood flow, that they are circulating blood in the heart and acting an important function for increasing heart rate or acting sympathetic nervous system on them. Coronary arteries are the circulatory system are the system for sending nutrients and oxygen or circulatory system in the heart. The main coronary arteries lie on the surface of heart, and smaller arteries then penetrate from the surface into the cardiac muscle mass. The left coronary artery supplies mainly the anterior and left lateral portion of the left ventricle, whereas the right coronary artery supplies most of the right ventricle as well as the posterior part of the left ventricle in 80% to 90% of people. Normal blood flow, coronary blood flow in resting person is about 70 milliliter per minute per 100 gram of heart weight, and about 225 milliliter per minute, which is about 4 to 5% of total cardiac output. And during exercise, this blood flow is going to be 3 or 4-fold to supply the extra nutrients needed for heart rate or heart work. So we know about 5% of cardiac output is going to coronary blood flow. And what is the blood flow in the coronary system? What is the pressure or circulatory system in the coronary circulatory system? Here by this figure you can see there is a phasic change in coronary blood flow during systole and diastole. Why? During systole the coronary blood flow is going to be down, and during diastole the coronary blood flow is going to be high and up. This is the effect of cardiac muscle compression. You know, during systole cardiac muscles is doing a contraction, so the level of coronary blood flow is going to be down. But during diastole, when the cardiac vessels, muscles are going to be relaxed, there is a blood flow in the coronary circulatory system. How coronary blood flow is controlled? One of them is local control and the other one is nervous system control. Local muscle metabolism is primary controller for coronary blood flow, and the first and important one is oxygen demand or oxygen level reduction, or low concentration of oxygen in the muscle cells is important and major factor in local coronary blood flow regulation. The other important factor is adenosine. Also some other agents such as potassium ion, hydrogen ion, carbon dioxide, prostaglandins, nitric oxides are known as another vasodilators for coronary blood flow. The second control of blood flow is done by nervous system control. Direct effects results from action of nervous transmitter substances such as acetylcholine from the vagus nerve and norepinephrine from sympathetic nerve on the coronary vessels is seen. The indirect effect results from secondary change in the coronary blood flow caused by increase or decrease the activity of heart. So sympathetic effect is more greater rather than parasympathetic, but both of them can doing a function of heart coronary blood flow. So we can say acetylcholine, norepinephrine and epinephrine on this nervous system control. Heart has some different situations for pathological condition. Some like ischemic heart disease, that is can be categorized as arteriosclerosis, acute coronary artery occlusion, myocardial infarction. All of these related diseases are related to coronary circulatory system. So The understanding the function of coronary circulatory system is an important factor to reducing the heart-related disease. Let's see what happened during bleeding in the body. During bleeding, blood volume and pressure is going to be down. Baroreceptor impulses deactivate. Vasomotor activity activate more than normal. So by these situations, heart rate increased without increasing the power of heart or stretching the heart muscles. Blood vessels vasoconstriction is seen, and kidney GI vessels vasoconstrict, skin vessels vasoconstrict, and because of that during bleeding the patient feel cold and the skin is pale. Muscle vessels vasoconstrict, and because of that during bleeding muscle weakness is seen. Brain and heart vessels does not constrict, is a protective way, and if the signs are not severe we can see a shock and reversible shock. Shock is stopping or reducing blood flow. If signs are severe, irreversible shock, or in case of 30% bleeding, we can see the die of patient. In some situations, such emotions and feelings like excitations, the hypothalamus activity is going to be increased. Vasomotor center activate. Heart rate and power will be increased. Vasoconstriction in kidney and GI vessels is seen. And finally, skeletal muscles dilate, vasodilate, and so the blood flow is increased. And because of that, we can see why during some emotions the blood flow is going to be increased. These two are extra to understanding the effect of some emotions or some pathological conditions on blood flow. Dear student, if you have any question, I'm glad to answer to your questions. Please ask me. Thank you.